So I want to give you an overview of my work in Sudan for those of you who aren't familiar with it, and some preliminary results of recent analyses that we've been conducting in the lab, and particularly over just the last 3 years or so. I want to forewarn all of you that there will be images of graves and human remains in this talk. So if you're uncomfortable with that, this is probably not the talk for you. Okay, my project area is in an area that was projected back in the early 2000s to be affected by the construction of the Meroe Dam at the Fourth Cataract in Sudan. And this region upstream of the Fourth Cataract had been written off by early archaeologists like Reisner, for instance, as being too rugged and inhospitable to support settlement. But the preliminary surveys of the affected area in the early 2000s and the subsequent fieldwork that's been conducted in the region shows that's really not the case. And you'll get some idea of that today. So I subsequently decided to continue working in this area even after the Meroe Dam archaeological salvage project ended in 2009, because I realized we really were just scratching the surface. And this area started developing very rapidly, endangering sites that extended farther into the desert and not just those by the riverbank. So my Bioarchaeology of Nubia Expedition, or BONE for short, is in this project area that's about 35 kilometers west of Abu Hamed, Sudan. And this is an area that's been experiencing a gold mining boom over the last several years, hence part of the development. My project area stretches about 33 kilometers along the north bank of the Nile River, right at the top of the Great Bend. And you can see here that the area is traversed by several large wadis and their tributaries, or khors, as they're called. We so far have recorded 228 sites in the project area that range from the early Stone Age all the way into the Islamic period. Most of the sites that are recorded are in the eastern portion of the project area, which is developing more rapidly. And you can see that with just the green area by the river here, but also in the panoramic view from across the river, you can see that agricultural area extending into the desert. And the prominent landmark that's showing up right up here is called Jebel Jalud. So I'll refer to that multiple times. Now, I mentioned the Stone Age sites. 29% of our sites recorded to date, a total of 67 of them, date to the Stone Age. And I'm doing research with the Stone Age use of the area with Dr. Deb Olszewski from the University of Pennsylvania. And she's found through her lithic analyses that we have substantial Middle Stone Age activity, particularly in this eastern portion of the project area. And just for reference, the Middle Stone Age spans roughly from about 285,000 to somewhere between 50 to 28,000 years ago in Africa. We have a little bit of early Stone Age, but mostly Middle Stone Age and all the way up through the present. So this area was continuously inhabited for a very long time. The cemeteries of interest that I'll be talking more about today date from the early Kerma period all the way through the Christian period. We do also have, of course, Islamic cemeteries in the area, though we obviously will not be excavating those. Now, what I want to talk about mostly are the Kerma period cemeteries initially, and then I'm going to talk about some of the later cemeteries. For the most part, the Kerma period cemeteries that I'll be focusing on today are in a cluster of intervisible sites. Okay, so that means that from one site, you can actually see all of the other cemeteries in the area. And these tend to cluster, as you see, around the wadi systems in the, just into the desert, the low desert. Whereas the later ones focus on the floodplain in the area which is intensively developing with agriculture. So many of those sites are disappearing. Now, the graves are typically covered by rock rings. So they're clusters or piles of rocks, or sometimes, as you see at the top left, separate dome graves. And dome graves are on the ridges, the upthrusts of granite, and they use some of that granite outcropping to form part of the grave. And then they just sort of mound up stones to make a semi-dome or a dome grave. So that's the variety you see at the top left. And then you see a tight cluster of smaller graves from the Kerma period at the bottom right. Now, the graves, the cemetery sites from this area span roughly between about 2140 to 1730 calibrated dates for BCE. So in this cluster of intervisible graves or cemetery sites that we've excavated, we've got a range then from the early to middle Kerma all the way up to Napatan, actually, but mostly to the end of the Kerma period. So mostly by about 1000 BC. Okay, now here you see a fairly tight cluster of about a dozen graves from the site designated UCSB 0314. And this designation was based on the original 2003 survey of the project area by Stuart Smith's team from the University of California, Santa Barbara. And so we worked together from 2007 through 2008. And then I continued in 2009 and subsequently had field seasons in 2014, 15, and 16. And I'm anxious to get back. So hopefully that will be possible at some point in the not too distant future. All right. Our graves are generally these superstructures of piled rock. The earlier Kerma period graves are about 2 to 3 meters across, so not terribly large. We've done 3D photogrammetry for select graves at each site and for the burial level with the skeletons in situ for every grave. So I want to show you some of the 3D reconstructions. And I'm going to take you into this particular grave, which was actually excavated by chapter member Elizabeth Miner and our conservator Rocío Diaz. Now, starting out, you can see there's a little bit of a divot at the top. And this divot is a depression that probably was due to grave re-entry. And I want you to pay attention as we go down level by level for how this starts to open up. And now you start to see in this area a small hole going down and targeting the area of the face and hands. The rest of the body is completely undisturbed. So this was something that appears to be a targeted re-entry of the grave. And a student of mine, Sierra Midhall, who's joined in today, and I are working on this to actually systematically examine patterns of grave re-entry, because we've had this sort of Western perspective that this is all looting. And in fact, that perspective may actually be biasing against understanding some of the funerary ritual, wherein people are going back into graves within memory of the person's burial, minimally disturbing it, and taking things like perhaps rings or necklaces, because we see areas typically targeted are the hands and the head neck area. And here you can see there's really very limited disturbance to the rest of the grave and little displacement. So this was something that was done very carefully in antiquity, and probably again within memory of this person's burial. So on the right side, once we remove the rocks, I want you to take a look. There's a callus that's formed, a big bulge in the bone where new bone has formed to mend together a fracture of her shin bone or tibia. So she's a good example. This is a woman who was in her 40s or over 40 when she died. And she has one of these accidental traumatic injuries, which is Not very common in the Kerma period sample, but it all seems to be accidental injury that occurred during that era. Bodies are flexed on the right side, with one exception at this site, and often with one exception or maybe two at some of these other intervisible sites. So there is variation in the positioning of the body, but also in their orientation. In the case of this oldest site, 0314, most of them had their heads oriented toward Jebel Jalud, so toward the north or northeast. Whereas in some of the other sites, they could have their heads oriented in the opposite direction or to the east or west. So there was quite a bit of variability in regards to the burial orientation in this group of cemeteries. Here you see a good example of a burial that's again been disturbed only slightly up in the head and neck and hand area. And the pots are under those rocks that they place atop the burial and the artifacts. And when those are removed, you can see that the pots are actually there. They've gotten a bit squished. So there are a lot of cracks and everything in them, but they are still perfectly intact in the burial environment. So they weren't disturbed at all. They weren't going back in to take whatever they could, in other words. That's in contrast to some other graves at this site and at other sites that are badly disturbed, suggesting that there was reentry for other purposes, or this reentry occurred long after the memory of the burial had actually faded. So Sierra, my grad student, is systematically using ArcGIS, documenting the patterns of reentry and the degree of disarticulation and what areas are disarticulated to really get a better handle on the patterning. And if this is a pattern that's a retrieval with targeted taking of heirlooms, perhaps, that are needed for the next generation. So doing something like this can really give us some insight into the important aspects of ritual and remembrance that our biased Western perspective about, oh, they're just going in and looting the grave, has really prevented us from seeing in the past. So just to give you a really good impression of the difference here, I think you can see this is a badly disturbed burial. You've got bones that are thrown out along the edges of the substructure. And here, this is the leg that's the only part that's still really intact. So I'm going to zoom in on that area, and you can see we've got one leg. We have some leather and red ochre, and one forearm and hand that are still relatively in situ. And that's it. The rest of the body was really just strewn about. So not treated with a great deal of respect, in contrast to those other two burials that I just showed you before this. So that's one thing that's currently research underway, and you'll hopefully hear more about that at some conferences upcoming. And that also contrasts with the more recent looting that's been occurring over the last several years, where you see, in this case, we've got a huge divot in the middle of the grave, dirt, sand tossed out. So we've got the back dirt pile from the looting event. And if you have sharp eyes here, you're going to see lots of bits and pieces of human bone. And in fact, there's a whole humerus arm bone right up there. So, this is an example of a recent looting activity with the bones just strewn about, bleaching out. So sometimes there is still bone down in the shaft, but we have to gather it up from the perimeter. And of course, the provenience has been completely messed up for us, and we don't know what might originally have been in this grave. Basically, these older sites have burials that are wrapped, bodies are wrapped in hides or placed on hides, and then sometimes mats as well. We have mat impressions, as you saw. There are dome graves at all but this oldest site, 0314. The 0930 site that is just to the north or sort of northeast of 0314 has larger superstructures, and they're more complex in the way they were constructed, but they have very small substructures, one of which you see here. They were also lined with rocks, which have been removed for this photograph, so we can fully expose the skeleton. There's a different pattern at ASU 1404 that's just to the south, and that one has some really large graves that are surrounded by small satellite graves. So that's something that's a bit different, and that one does seem to be running into the Napatan period, so classic Kerma through Napatan, so a little bit more recent in time. Again, the body positions are variable, the orientations vary, but they're usually placed on the side in this flexed position. Only the site 314, that oldest one, contains pots that are at the body level. The other ones have pottery, but it seems to be broken up throughout the shaft bill and then often in the superstructure of the grave under the rock cairn. So there are different strategies and different ways of placing the pot offerings that suggest that there's change in funerary ritual over time. Now, I want to take you to site ASU 0901, which is just across a little wadi from 0314. Some of you who've heard me talk before a few years ago have heard about a particular burial at this site that I want to revisit and catch you up on. So this site, as you can see, has some dome grave construction. The dome graves are overlooking Jebel Jalud, the edge of the site. Okay, so that's a dome grave there. And we also have standalone tumulus construction just out on the flatter area of the site. In the distance, from the top picture here, you can see there are some people working right there. That's that outlier grave. And this particular grave was of great interest because it held the burial of a woman who I thought might be a potter. Okay, her grave is one of the oldest at the site, and the site dates range from about 1751 to 1370 BCE. And her grave is on the old end of that scale from about 1751 to 1619 calibrated BCE. Okay, so she had really unusual sherds that showed vessels with a different shape and a different sort of design with the cross hatching. And we found a few similar sherds at some of the other graves at this site. And our ceramicist, Alexandra Cisak, from the University of Toronto, has done petrographic analyses, and she indicates that the fabric is from local clay. So these are not imports, they're being made locally, but they're a different shape and different design that appear more like Butana and Gash group in the, sort of in the Butana desert and toward the area of Kassala today. She also had a bone tool that was buried along her back. You can't really see it very well in her burial picture, but it's right there. Okay, and this bone tool looked like something that she might use to incise and burnish pots with. Okay, and I've talked to a lot of potters who all agreed that, yeah, that looks pretty much like tools that people might use today. It's made out of an animal bone limb shaft. And it's been used extensively. It's quite worn. Now, she had indications on the internal sides of her ribs for respiratory infection because there are nodules and grooves and things that suggest that she had a respiratory infection. And when she was excavated, this granuloma was discovered. So you see this little calcification here, this nodule, and also some little bone plaques on the inside of her thorax. So these kinds of things don't develop unless you have a severe lower respiratory infection that's chronic, something like tuberculosis, chronic bronchitis, those kinds of things. But a granulomatous disease that produces those kinds of nodules has to be something like TB, or it can form from a non-infectious source if you're inhaling lots of particles of dust. So silicosis is something that you might have heard of. And silicosis is sort of an occupational hazard of miners, people who operate jackhammers today, breaking up concrete and those kinds of surfaces, generating lots of dust. If you're inhaling the dust, you're going to be at greater risk of developing that kind of a lung infection. It's not an infection, it's just induced by the inhalation of all of these particles that start producing a reaction of the lining of the lung and these calcifications. Potters are also at risk of developing silicosis. So I had this idea that if she's a potter, maybe this is silicosis and not TB. So how do we get at that? Well, I actually was able to get the nodule scanned with micro CT. So we have that here, and I thank Alejandra Ortiz for doing that for me. And you can see here the formation of the this nodule is very regular, and there are no voids in it. So if we had an infectious source of this nodule, something like tuberculosis, they're called caseated, which means cheese-like, and they've got holes in them. There are voids in them because of the way they form. They're a reaction to the tuberculous bacilli. In this case, it's all very regular, and that suggests that it's a non-infectious origin. So I'm quite confident that she in fact had silicosis. Now, some of you may remember there were also malformed teeth, some tissue, and ossifications in her pelvis. And some of these you can see showing up. These are a couple of the teeth right here on the right side of her pelvis. Okay, this is very odd. So you think probably, oh, she was pregnant when she died. But no, these are fully formed teeth. There's a close-up of it. And they have roots. They're not just tooth crowns. And these are similar to permanent molars, not something that you would find just starting to develop in a fetus. So this is from a teratoma, which is often it's a benign tumor that forms typically in women. It can also happen in men, but it's typically found in women. And hers, you can see we've got teeth, this tissue mass, and then these little ossifications. And some of these look like little cranial bones, but they're not. And that one looks like it might be a wrist bone or something, this little round nodule. So this is something that just formed in a mass from multiple tissues and started growing in her abdomen. And in fact, when I went back and reanalyzed her skeleton, or analyzed her skeleton in great detail, I found that her lower right ribs, and remember this is on the right side of her abdomen, it was probably in situ. The right lower ribs are actually really bent into an almost straight line, so bent way out from their normal curvature. Normally these would be quite curved around toward the front. You know, I think you can all feel your rib cages and know how curved your ribs are. So these are very straightened out, which indicate that she had what we would call a giant teratoma, and they're considered giant when they get more than 15 centimeters in diameter. And hers was so large that it deformed the ribs on her right side. The left side, perfectly normal ribs. So I suspect what killed her was probably a rupture of this giant teratoma. I can't prove it, but it seems to be the most reasonable explanation for a woman who died in her 40s. Now, every time I look at this poor woman, I discover something else. She also has a condition called Hyperstosis Frontalis interna. And this is a condition where you've got new bone forming on the internal surface of the forehead, so the frontal bone. And you see here, this is the eye orbit, this is the frontal sinus. And here you see these nodules and some of these, sort of raised undulating areas where the bone has thickened. We don't know what actually causes this, but today it's been largely associated with hormonal shifts in postmenopausal females, although males can get them too, but it's really predominant in females. But that may not be the case in antiquity. So as we're starting to find more and more of these cases in antiquity, we're finding that there are some young males even who have this. But this may be part of hormonal shifts that could have been going on and causing that teratoma to grow. Don't really know for sure, but she's got that going on too. And this is one of the oldest known examples in Sudan, in ancient Nubia. Now, if she's a potter, what was she doing with her arms and her hands? Well, she's not in the world's greatest preservation, but we do have the shafts of both arms preserved well enough to see that she's got really pronounced deltoid tuberosities, the area where the deltoideus muscle attaches. So she was really using her arms a lot, as you might imagine. If she's making some big pots, that's going to really work those muscles. If you look at her wrists, her left wrist on the left side, her right wrist on the right side, you can see that her left wrist looks pretty messed up, doesn't it? I'm so used to doing these in person, I'm always throwing out questions and wishing I could see some of you nodding. But you can see, especially with the scaphoid bone, that this is the bone that's at the base of your thumb. I'm going to show you a close-up of the two side by side here. So you can see just how different those bones look. She suffered some trauma to her left wrist that has caused the scaphoid bone basically to get crushed and sort of expand. And you see there's a lot of arthritic changes, particularly in the extant carpal bones of her left wrist. We're missing two of those bones. The right wrist is complete, and you can see they look a lot smoother. But there is a little bit of arthritis evident in a couple of the bones on the right wrist as well, but it's not nearly as severe with the lipping and porosity that you see on the left side. So that left and right scaphoid look initially like they came from a different person, but they are in fact all from the same burial. So, I have no doubt they were from the same woman. It's just that this one has been badly injured in the past during her lifetime, and it got kind of squished. So this was probably something that happened due to a fall onto her, outstretched arm. It didn't break the back of the wrist, but it broke the scaphoid bone. So something, this happens with baseball players, that they can break a scaphoid bone, or often the hook of the hamulus bone, this one that sticks up here. So definitely a pretty severe wrist injury occurred to her at some point during her lifetime, but it's healed and gotten arthritic. Now, going right along, this woman has very few teeth left in her mouth, and what's left has very little tooth enamel left on it. The extant teeth have been worn practically down to the roots. They're just little nubs, and some of them have no enamel left on them whatsoever. And what you're seeing here is the right maxillary first premolar in her mouth, and this is the back of that tooth. Okay, yeah, there you go, Barbara. You got the upper right premolar, so right behind your canine tooth. And there are grooves on this. There's a groove, and you're probably looking at it going, I don't see a groove. If you look very carefully right here, which is the cemento-enamel junction. It's the juncture between the tooth crown and the root of the tooth. And she's had a lot of recession with exposure of the tooth root, and there's a groove right at that junction. Trust me on that. I know it's kind of hard to see. It's very difficult to photograph these. There are 6 individuals from these Kerma period cemeteries that show these sorts of grooves in between teeth. And that suggests that they're using a toothpick probably, or perhaps drawing fibers through, much as we would use dental floss. But they're wearing grooves in the teeth by doing this, and just under the gum line basically. So it's a dental hygiene practice that really hasn't been recognized very well. And I'll be talking more about this in a presentation, hopefully at the RC conference in April. So you'll be hearing more about it. And I know that last one was difficult to see, but here's another one from UCSB 0314, the oldest site. And you can see that groove right there at that juncture between the tooth crown and the root, right at that cemento-enamel junction there. And it continues into the Christian period. So for the large Qinifab School site that I'm going to talk about in a few minutes, we have another individual, and you can see a really prominent groove. That one I don't think you have any trouble seeing whatsoever. So 7 individuals altogether, 6 from the Kerma period, at least 1 so far from the Christian period, but we haven't gone through systematically to figure out if anybody else has that yet. So stay tuned for more on that. All right. Now, I've also been doing stable isotope analyses with Leslie Gregorica from the University of South Alabama for strontium isotopes that are used from the tooth enamel to assess mobility, because the strontium can identify first-generation migrants, people who grew up someplace else where there's a different signal of strontium in the groundwater that they're drinking and the foods that they're eating. So geologically, different areas have different strontium signatures. So that will help us assess population mobility. One of my graduate students who just got her PhD in May also assessed carbon and nitrogen from the more recent site, the Qinifab School site. Unfortunately, another student from ASU was trying to obtain carbon and nitrogen from the Kerma period teeth, but unfortunately there was simply very little collagen left and not enough to make this feasible. So we aren't able to reconstruct diet for the older segment of the population. Okay, so looking at the mobility from the strontium and these ratios of radioactive isotopes of strontium, we can actually see that we have a local level that's generated by faunal remains and also the diagenetic human enamel. So that is not very well preserved. We can't really use it to assess mobility, but it helps us establish this baseline. So you see on this chart that Leslie Gregorica made that we've got lots of people throughout the early classic and late Kerma period falling into this local level of strontium. So these are people who grew up there and pretty much stayed put. They didn't move around a lot. But take a look at the difference in the number of people from the early to middle Kerma period, from the oldest graves, who show different signatures outside the local range. And that tends to decrease through time. So we have a sample showing more mobility earlier on, declining through time. And one of the things that we were also interested in is whether people who had non-local grave inclusions were immigrants into the area, or if they were local and importing these materials in. And also, looking at non-local individuals and, did they have imports or exotic materials with them? So these next couple of slides address those issues. So here you see 2 individuals whose strontium isotope ratios were in the local range, but they were buried with unusual or imported items. On the left is the burial of our potter with the teratoma, and you see her ceramics. We know it's local fabric, but where did she learn to make them? Did she grow up someplace else and move into the area and make them like she learned to in the other area? Or was she inventive or really just admired that kind of pottery? Well, it turns out that she actually is local. It's possible that her parents might have immigrated into the area, and she learned to make pots from one or both of her parents. Those ceramics, again, have affinities to the Gash group and Butana Desert to the southeast. So that's a big question with her, but she has local signatures of strontium. So she did grow up in the area and died there as well. Now, this other one, you see an import. This is a New Kingdom pilgrim flask that was imported from Egypt in this burial from 0930, just to the northeast of, just north of this one, actually. And here again, we have an imported vessel associated with somebody who grew up in the local area, a local strontium signature. So this means these people were tied into trade networks, acquainted with other styles of ceramic vessels and so on. Okay, now, what about unusual or non-local items that are with some of these non-local people? Okay, if we look at those and particular individuals, for instance here, we have UCSB 0314, the older cemetery with burial 6. We have an imported Egyptian vessel, and we have one that resembles Pangrave style. For those of you who are familiar with Pangrave, it's got that black rim on a redware bowl. Okay, so that's Pangrave affinities. This person has these non-local objects and is non-local in terms of their residential mobility, where they grew up. Okay, likewise, we have another individual from 0930, just to the north, burial 10, the only person who was buried with bone beads in this or even in the more recent site. So these are kind of different. He is older male, adult male, and again, only one excavated so far in the entire project area with bone beads, and he also has a non-local signature. So that suggests that maybe these were members of a mobile community that traveled outside of the project area during their childhood, during the time that the enamel of the permanent teeth was forming. And that can continue up to around age 15 for the third molars. So one of the things that Leslie and I are planning, we're getting more information from additional teeth, and we're also going to expand this into the more recent time periods to see, again, how do things change through time. So our mobility evidence here, just to sum up, the mobility and the isotope data, we've got a high degree of mobility in the early to middle Kerma phase that decreases in subsequent phases. We have non-local goods throughout the Kerma phases and continuing all the way, through the Christian period, showing that these folks, even though they were perceived to be out in the boonies, the hinterlands, they were integrated into these interregional exchange networks. Some of them may have been mobile folks who were moving out into the desert, hence they may have a different signature. The declining mobility occurs as the Kerma state coalesces. So one thing that may indicate is an increased linkage of this area to the Kerma core around the third cataract as we move through time. Okay, now I quickly want to mention some of the individuals from the more recent era and some of the differences from the late Meroitic to the post-Meroitic period and into the Christian period. So we're shifting to the early centuries AD here. And this is when the area between the fourth and fifth cataracts were, somehow, for some reason, they decided they needed to fortify this area. So we have a whole network of fortifications, and one that's actually in my project area here, known as Al-Hush, or the enclosure. And you see it's just in between two others in this general fourth cataract area. So they're clearly very interested in what's going on and controlling what's happening along the Nile in this area right around Logron Island. Okay, we have a shift in where the cemeteries are located. So those Kerma period cemeteries are on the desert margin along the wadis and khors, and we have floodplain cemeteries as we move into the late Meroitic period. These are much larger cemeteries, and they have, as you can see, huge tumuli in some cases, much larger. They have much larger substructures that have burials that are in chambers off of large grave shafts. They are often outfitted with necklaces, belts, lots of pots. As you see here, we have a little evidence for shrouds, but not nearly the preservation that some other groups had across the river, for instance, with much more shroud material. So that was in the western portion of this site that was once a continuous site, now interrupted by a date palm grove and agricultural fields. And here you see the eastern portion. Yeah, dogs get out there too. I don't know if you can hear the dogs barking next door. But the total skeletal sample from the eastern and western portions of the Qinifab School site is 100 at present. Most of these, let me just go back quickly. You can see most of these have huge divots in the top because they have been re-entered multiple times in some cases. We had one that was completely intact at the western end, and this is one of the most amazing graves that I have ever excavated. And it's because there was a young woman in it, a female who was in her late 20s to mid 30s. She probably had already had children previously. If you take a look at her, you see the bowls. She had a bead circlet around her head. She's wearing some rings. She has her right hand over her abdomen. Her left arm, as you can see, is extended. Here is her left hand, and there's a lump here. It's like, why isn't that nicely excavated? Let me zoom in. Here you see rings on her fingers. Okay, she had the rings on both hands. So this gives you an idea of what they might have been going after in a grave re-entry, what they were targeting to retrieve. One of the things that I could not figure out in this burial was what had happened to this little baby's head. So you see here are little feet, the legs are crossed, the lower legs are crossed. Here's the left hand and left arm. You see the rib cage here. Where's this baby's head? That's why I excavated this hand oh so carefully, thinking it must have dropped down into her cupped hand. It wasn't there. Here you see two little bones. These are the lateral parts of the little bone at the base of the skull that haven't yet fused together because this is a developing fetus. And I knew from excavating these bones that this was not a full-term fetus. It appeared to be premature. Mystery, where's the head? We take off the right hand, and the head was lodged in the poor woman's pelvis. This is a breech birth delivery. The baby came out feet first. The modern incidence is 3 to 4% at full term, but it occurs more frequently before the 34th week. And the mortality in a breech position is 4 times higher than in head first delivery. And it's due typically to the baby being premature, so it hasn't yet rotated into that head first position. Sometimes it's a premature delivery due to congenital conditions. The baby usually will die due to birth trauma, intracranial hemorrhage because the head is trying to, squeeze out from the wrong angle. And typically they're asphyxiated. Often the cord will be wrapped around the neck. There is a very, very limited time in which a midwife or a doctor today could actually try to get their fingers there to pull the chin down and get the baby's head with the chin down to come out okay. But it's a very, very tiny window of time. And if that doesn't happen, then nothing can be done. And that was unfortunately the case here. So we have a baby that was about 7 to 8 fetal months, so not yet full term. So that was a really, really amazing burial. As I said, it's one that, you know, you really get a very swing of emotions when you excavate something like that. You are amazed and excited because it's something so rare to see. But on the other hand, you're weeping over the burial because it's just, you know, so horrendous to think about, you know, what happened to this woman and her baby and to her family and the community in general. It had to have been, you know, a very, very traumatizing event for all. Now, among the many, many grave goods that we have in the late Meroitic through the post-Meroitic are imported goods. So you see here a silver nose ring. Silver is found in Western Sudan. We have Carnelian beads. There is a source of carnelian in Western Sudan as well, but this one, based on Jonathan Obluska's work, a Polish colleague who's analyzed all of the beads, this is actually from the Indo-Pacific region. So again, these far-flung trade networks, and she's also identified drawn glass tube beads that are also likely of Indo-Pacific origin. So they're crossing the Indian Ocean and probably coming over the Arabian Peninsula into Egypt and Sudan. We have at this point in time, coinciding with these fortifications, lots of iron arrowheads and archers' luces, or knocking stones as they're called. They appear in the graves of 8 males, no females, just males. And at this time, we start to see evidence of conflict. So it's not just archery equipment as a symbolic thing. They are actually using it, and you can see this is a breastbone, a sternum that's been penetrated by an iron arrow point in one of our burials from the Qinifab School site. There's a lot of healed and unhealed trauma that's due to interpersonal violence in this particular cemetery. And again, you know, this coincides with the construction of the fortifications. So you have to realize there's something different going on in this area with people trying to protect themselves, but being subjected to conflict and incursions. And in this example, this is a woman who was probably over 60 when she died. She had multiple healed injuries, including evidence, clear-cut evidence here of interpersonal violence. So she has a depression fracture. You can see a little divot there on the back of her head on the left side. So she got whacked on the head. It depressed the bone in a circular sort of pattern. And here you see a close-up of that, very, very well healed. So she survived that, as well as a lot of other trauma in her skeleton, including a blunt force blow. This may actually have been sharp force trauma across her right scapula. And it's shortened the bone. So you see the left scapula that's normal in comparison. So there was a big gap that had to sort of heal that open area of the scapula, and it shortened the bone. It also broke some of the ribs below the scapula from the blow or that was sustained. So those ribs healed as well. And there you see just from the lateral views of the scapulae how much shorter the right one is than the left, and also the severe osteoarthritis in her shoulder joint. And that's pretty evident from the lipping and porosity on the humeral heads. and to the point where there's bone on bone polish. And if you feel that, it's extremely smooth and it glistens in the light. It's shiny. It looks like a cue ball. She also had a dislocated jaw. So you see the condyles of her mandible are very eroded away. There's hardly anything left of them. And they fit onto, up into the skull on the temporal bone, forward of where you would normally see that articulation. So her jaw had been dislocated as well. And that's not even the worst of it. She had this horrible fracture of her proximal left femur and proximal right femur, I should say. And it has displaced the head of the bone. So but it was still fitting into the socket. You know, we excavated her, it was still fit into the socket. So it didn't get dislocated in that way, but it was dislocated in terms of slipping down and twisting so that she would not have had a normal gait. And on the posterior side, the back of the bone, you can see that muscles have ossified to try to stabilize that bone. She survived all of this. This is amazing. And we're not done yet. This is a remarkable woman. She had compression fractures. These were of the first lumbar vertebra. So you can see the bone is broken on the top here, and it has sort of squished the bone. This would be from a fall that's compressing the back if you land on your butt, for instance. And it also broke the right hip bone. So it was her left femur that was fractured, and her right hip bone is disrupted as well, right where the pubis and the ischium fuse together when you're a kid. So that's sort of a weak juncture, and it broke the bone right there. But it's knit back together, and she survived it. And here you can see the 12th rib also subject to compression. It looks sort of like an accordion. That would not have been pleasant. So amazingly, you know, people survive those kinds of injuries, and she lived into old age. She was at least in her 60s when she died. So she had to have had a lot of help from the community. And there are other people who didn't make it, unfortunately. We have a lot of children who died in their, in their toddlerhood. So here you see cribra orbitalia, these lesions pitting in porosity in the orbits of the eye, the roof of the eye orbits. And that's usually coinciding with some form of anemia. They're not getting enough protein. It may be due to parasite load. It may be due to infectious disease with a lot of bouts of illness, and it could also be due to malnutrition. And we know that there's a dietary shift between the post-Meroitic into the Christian period. So Annie Laurie Norris, my PhD student who just finished up in May, found that there was a decreased amount of protein in the diet and an increase in the consumption of plants like wheat and barley rather than sorghum and millet. So that is also increasing with dental pathology. So dental caries or cavities in your teeth are also increasing in the Christian period. So we have lots of evidence here going on for this subsistence shift, or at least they're using different crops and perhaps more intensive agriculture that's coinciding with poorer health and malnutrition. And I have just a few slides left to talk a little bit about some of the aspects of identity and the avulsion of lower incisors. Often it's just 2 teeth, the 2 lower front incisors, but in this case it was 4 teeth that were taken out purposefully when this person was probably a teenager. And so you see this ridge of bone where those teeth would have been. And it occurs in both males and females. About 12% of our sample from the Qinifab School site has dental avulsion. So it's cutting across sex. It doesn't seem to coincide with particular graves or sorts of people continuing through the Christian period, but at a lower rate. Today, it's still found in a small number of people, typically is associated with identity, but there may be some medicinal reasons why avulsion occurred. And actually, that poor woman with all of the healed trauma who I just showed you has one of her lower incisors, just one, taken out, and it may have been due to all of her problems and the dislocated jaw, that it could have been taken out just to try to make it easier for her to fit a straw or something like that into her mouth to ingest some gruel-like foods. Now, we have an amazing find here with two individuals from the Kerma period, well, one's Kerma period and one's Christian period, in my project area, who have transmigration of the right mandibular canine tooth. And you're thinking, what the heck is that? Well, today, canine tooth impaction, mandibular canine tooth impaction occurs in less than 1.3% of patients in clinical studies. And transmigration, where that impacted canine tooth starts moving across the midline to the other side of the mouth, is only found in about 40% of those cases. So in other words, that's less than half of 1% of people who show transmigration of a mandibular canine tooth, permanent canine tooth. And archaeologically, it has rarely been reported. So finding two affected individuals in the bone project area is really pretty amazing. And as I mentioned, one is from the Kerma period, and this one here is from the Christian period. But that's a rate of 1.71% for the 117 individuals who have sufficient dentition, anterior dentition, to be observable. So you can see here that this canine tooth is just drifted across the midline so that its tip is actually under the left incisors, heading toward where the left canine has fully erupted. And these are severely worn teeth because this woman was probably 60 plus when she died. Okay, we don't know exactly why this occurs. It can happen for multiple reasons. One of which is retention of the deciduous canine tooth. And another is that you may have some infections or something like that, and people might think, oh, we should pull a tooth. And then it disrupts the tooth bud for the forming permanent tooth below it. So it then gets impacted. And we can see here this ridge of bone where her deciduous canine tooth was removed purposefully. So that may be a possible reason for that extraction, but it disrupted the formation and the eruption sequence for this canine tooth. So this is giving us, it's really technical stuff, but it's giving us insights into cultural practices that may have existed among these people in the past. Now, one of the last things I want to mention here is some work that's underway with Kanya Gotti at Laverne and Jamie Ollinger, who's in Connecticut at Quinnipiac University. We are doing a biodistance analysis to investigate variants of dental formation and cranial traits. And these are called non-metric traits because you can't measure them. You grade them in terms of their expression. So on the teeth, for instance, you can have shoveling of the incisor teeth, so they look sort of scooped out. You can have extra cusps on teeth. And those kinds of things that can be recorded if the teeth are well preserved and not super worn. So you can imagine we've got some missing data, particularly with some of those older individuals. For the cranium, we're looking at things like extra bones. This is a bregmatic bone that's formed between the sagittal and coronal suture on the top of the head. You can look for bony bridges that cross over foramen, holes in the skull. You can look for other areas where you may have multiple openings instead of just one. So there are all sorts of different variants that have a genetic basis that can be assessed and used to evaluate population relationships. So we're exploring the relationships within and between the cemeteries and ultimately over time. And we also want to assess the relationships with people beyond the project area. So again, this is very preliminary. We're going to be working on a poster presentation for an upcoming conference in March, looking at the intracemetery relationships within the Qinifab School site. So here's the western part and the eastern part. And the western part is to the southwest. So, you know, it would actually be a little bit lower. I haven't gotten these matched up quite well enough, but I don't have enough space on my screen to do that. So you see in the western part, which is the older end of the site, lots of graves from cluster 3, which is marked by the green. And we have only a couple of graves from cluster 2 in yellow, and just one from cluster 1 with the purple. As you move to the northeast, as the cemetery grows, you can see we've got a little bit of green toward the southwest, but here, this one's one of the older burials at this site, as is this one. A little bit of green from cluster 3, which seems to be the founding group for the Qinifab School site, for this cemetery. But as it expanded, and as we go through time into the post-Meroitic, the later centuries AD, or still the early centuries AD, but as we move into the 400s, 500s, the 600s to 800s for the Christian period clusters up here, you can see that clusters 2 and 1 predominate. So we have sort of a shift here, and I'm going to give you a close-up, a bigger zoom in here on the eastern portion of the site, so you can see that a little bit easier. We have cluster 2 dominating the really big tumuli that surround the more centrally located cluster 1 people in the purple. And a lot of these are smaller tumuli, okay, for the ones that are in tumuli, or these are subsurface graves that didn't have big tumuli, maybe just a few rocks to mark them. Okay, so there's a difference there in terms of who's getting buried in what kinds of graves and how they seem to be related to each other. So we are continuing to explore those relationships, and hopefully those ongoing analyses will continue to clarify the relationships among the people, among the sites through the different time periods, and with people across the Nile Valley, and perhaps, you know, as we continue this kind of work farther into the desert, the Butana area, and so on. So we are getting all sorts of insights into ideology, health, individual lived experiences with some of the examples I've given you today. And these are related to subsistence practices and shifts in the subsistence, the social organization and ideology, as well as to climate change over time. So with increasing aridification, and the haboob is there to remind me of that, you know, you see that you've got these shifts from more pastoralist mobile people to more settled agriculturalists, and even a shift in the kinds of crops that they were growing and utilizing. So that is just some insight into the ongoing research, and I'm sure you've got lots of questions. So thank you for your attention. Barbara, you're muted.
I'm sorry. Thank you very much, Brenda. My phone is about to die, so I've asked Glenn if he will read off the Q&As for you. Thank you so much, Glenn. And Just one last thing. February 6th is our next lecture with Dr. Rosalind Campbell of the Getty Research Institute. So we will see you then. Thank you very much, Dr. Baker. Take care.
Thank you, Barbara.
Here come the questions.
Okay, so first question from Sid Kitchell. I believe Egypt does not allow biosamples to leave the country. What is the policy in Sudan? Is it based on law or bureaucratic decision?
Sudan in the past has allowed export of much of what you've excavated. There is a panel of inspectors at the National Corporation of Antiquities and Museums who review all of your finds at the end of the project, at the end of the field season, and then they will do a split with you and tell you what you are allowed to export so that you can conduct further analyses. In the past, that's included all of the human remains. That's changing as we get, more infrastructure established in Sudan, and also more people trained in bioarchaeology and human osteology, so that it's probably more likely moving forward that we would just be exporting samples for things like isotope analysis, and the analyses would have to be conducted there. So that is undergoing some shifts.
Okay. Next question from Barbara Wilcox. It says, can you tell handedness from her bones?
Well, it's difficult. I think you're referring to the potter. Both of her upper arms were really well developed. The right a little bit more so than the left, but they were both pretty well developed. Her left wrist obviously had that trauma, so that may be why the right looks a little bit more developed, because later in her life, she may have been compensating for the wrist injury as she continued her potting activity. She was still throwing pots and so forth. Given the condition of her carpals and all of the arthritis on them, that would suggest she might have been left-handed, but because of that traumatic injury, it's more likely a consequence of the trauma. So it really isn't clear, she was right-handed or left-handed. She probably used both arms and hands a lot. So she may have been more ambidextrous.
Okay, there was a question from Jesse Fournier along these lines, so I'm going to skip over that one because I think you just answered.
Yeah, I think I said that.
Okay, was wondering about reburial. This is from Lorraine Stratcotter. Excuse me if I mispronounced that.
Lorraine, these have all been excavated with the cooperation of the National Corporation of Antiquities and Museums and the involvement of members of the local community in the project area. And they have been gifted to Arizona State University. So they are not intended to be returned at any point in the future. Part of the reason for this is because at the time of the field work, the most recent field season being 2016, Sudan did not have any storage facilities for the human remains. And there's now only one person who really has gone into bioarchaeology to get the osteological training and so on. So there weren't enough people who would be interested or have the expertise to undertake any of these kinds of analyses. So, that's a problem there, having a dearth of storage space, a dearth of a budget to actually provide that, and really not a lot of training opportunities in bioarchaeology. And this is something that's been problematic in Egypt for a long time, but is being resolved as we speak, over the last decade or so, and that's continuing to improve in Egypt. So I imagine we'll see some similar developments in Sudan over the next several years, particularly post-pandemic and post-political upheaval.
Whenever that ends, right?
Yes.
So Teresa Moore asked, did you find any evidence for osteoporosis in older individuals?
Hi, Terry. Yeah, there are some older individuals who have very lightweight bones, which suggests osteoporosis, but they haven't been scanned or, any sorts of analyses done specifically to document the osteoporosis. So that's something that could be done in the future. But yes, I do believe it's there.
Okay, so I'm having a little trouble with the next one, but I'll read it to you, and if you can
Oh,
make,
yeah, I can take a look at it.
okay,
I mentioned the indentations in the graves, possibly for access to retrieve heirlooms. So the times would be buried, but then retrieved for, oh, I think items would be buried, but then retrieved for the subsequent generations.
okay.
Yes, that was the hypothesis that I had proposed to my grad student to investigate, is that, when you see these smaller reentry holes and very little disruption to the grave and this targeting of particular areas, that maybe they're going back in there within memory of that person's burial because they know exactly where to go without really disturbing the rest of the body or grave goods that are in there. So they may be going for bracelets, rings, necklace or pectoral kind of thing. That first woman who I showed you, she had a faience bead circlet around her head that was still, it had been disrupted, but they didn't take that. So they may be taking things like bronze rings, necklaces that may have more precious elements, carnelian beads, something like that. And it's perhaps because they are retrieving them for reuse for burials of subsequent relatives.
Okay, so Zainab, excuse my pronunciation again. Zainab Hashesh says, what an amazing lecture, Brenda, thanks. Did you use DNA analysis in your work in the Sudan? Did you find any evidence of cut marks in the materials, especially the cervical vertebrae?
Hey, Zainab, are you still with us? I can't believe you're still awake. She's in Egypt. So we attempted to extract DNA from the Kerma period sample so far, and we weren't able to get any viable DNA. The preservation for the Kerma period is such that the collagen preservation is really quite poor. Most of the protein is leached out of the bones and they're very brittle. So there isn't sufficient left to, do radiocarbon dating or DNA analyses or even the carbon nitrogen isotopes. So that didn't work, but we're going to give it a try with the Post-Meroitic and Christian period sample, which is far better preserved, and hopefully we'll get some good results with that. No cut marks in the vertebrae other than somebody who appears to have been hit by a projectile of some sort.
Okay, so you're going to get another a chance to answer the same question in a different way. Lorraine Stratcotter says, I'm about reburial in the context of prehistoric practices.
Oh, okay. Yeah, I'm sorry. I misunderstood that entirely. Reburial in the context of prehistoric practices. No, these are the individuals themselves, their bodies have not, we don't have evidence in these graves for secondary burial. In other words, people who've been gathered up and redeposited at a later time. That's something that does happen in Egypt sometimes, but haven't seen that so far for this sample. But those heirlooms that they may be retrieving from grandma's grave, for instance, could well be buried again with someone who, some other family member who then dies. And then they may be retrieved after that person is deemed no longer to find them useful or need them in their journey. So again, it's giving us a lot of insight into, the ideology and, what's a culturally sanctioned practice for re-entering these graves that we've just deemed looting. And it's not looting at all in that light. So hopefully that answered your question a little bit better.
So Janice Yellen asks, with the carefully reopened graves, is it possible that rather than removing objects, they were putting objects as offerings or for the tomb owner? Or question mark for the tomb owner?
Given that the heads are typically separated from the vertebrae, and the cervical vertebrae get messed up, the hands get disarticulated, it seems that they're taking things rather than trying to put things in, because we have no evidence of whatever might have been placed around the neck, for instance, or on the hands in most cases. So so it suggests that they're taking them rather than trying to re-enter to put something else in the grave.
Okay, so the next question, if artifacts were being repurposed and used for later generations, what evidence might we have for artifacts that would have predated the burials they are found in their later use? This is from Gretchen Zoller.
Hi, Gretchen. Yeah, that's one of the problems that I think we have to face with dating based on artifacts, is that some of these things, if they are in fact heirlooms, may have been reused over a couple of hundred years. So we may find that the radiocarbon date that we can obtain suggests something that's a little bit younger than what we might suspect with some of the datable burial items. So we got to be careful there, because I think a lot of these things were actually being reused.